People aren't going to know this. And I think a lot of practitioners don't even know this if they're not really niche into this area. The health of our microbiomes throughout our body, impact our ability to get pregnant, to sustain a pregnancy, to have a healthy baby, the health of our baby postpartum, and even the health of our grandchildren.
Dr. Elizabeth Wade obtained her doctorate in naturopathic medicine from the National University of Natural Medicine. Her practice is medically based and naturally focused, with an emphasis on individualized and collaborative care, believing that there is no one-size-fits-all cure.
People can have really great digestive function and still have very disrupted gut microbiomes. There are so many people who have really imbalanced gut microbiomes where, they are having constipation or loose stools or acid reflux, heartburn, bloating, excessive belching, very commonly, and they don't really think sometimes twice about it until maybe infertility comes on board and they're struggling to conceive, and then they're in my office and they're kind of wondering why I'm asking them about their gut health. 70% of our immune system is in our gut. So if we're getting sick a lot, and if our body is just generally showing signs of being really inflamed and uncomfortable, it's always a good idea to deep dive into your gut.
Welcome to Prescribing the Truth. I'm Dr. Nichole Morris, a Catholic naturopathic doctor and natural fertility expert. Around here, we don't just accept the mainstream narrative, we question it. My goal with every episode is to share the love of Jesus with you and empower you to make informed, confident decisions for you and your family. So grab a cup of tea, get comfy, maybe even throw on your tin hat, and let's dive in. Welcome back to Prescribing the Truth. I am thrilled to be here with each of you listening today, and I am super honored to have my colleague and my friend, Dr. Elizabeth Wade, a fellow naturopathic doctor, here with us today to chat a little bit about the microbiome and the influence that the microbiome has on preconception health, pregnancy, postpartum, baby's health. We're going to kind of dive into all of those things and how our microbes influence how our body functions. So welcome. Thank you. I'm really honored and excited to have you here with me today.
Thank you. Thank you so much. Yes, I'm excited to be here and talk about my favorite subject.
Yeah, let's dive in. You are, in my eyes, an expert in the microbiome, especially compared to my knowledge of the microbiome. So I'd love to hear, what kind of got you into this and what started your path down your research and investigation into our microbiome?
Yeah, well, I always wanted to focus in infertility. So my practice really started off in that niche. And I was really passionate about helping women develop good relationships with their menstrual cycle, understand their menstrual cycle, heal, some of the common ailments that many women would struggle with, painful periods, endometriosis, etc. And naturally just help women preserve fertility and go into fertility being as strong as possible. And the way that kind of intercepted with microbiome health was kind of random. I was at a conference and I saw this famous microbiologist, Kwan Kushnan, do a talk on his company, which he's now sold, but it's called Microbiome Labs. And I was really inspired by his presentation and asked if I could get involved with the company in some way. And I just got involved with them early on. It was probably 7 or 8 years ago. And, subsequently I just started doing a lot of research for them, writing papers on how the microbiome influenced different areas in health that I was interested. So they kind of gave me free range to study and look at and summarize the research on any topic I wanted and write papers on it for many years, and how it's linked to the microbiome. So through that, many talks, and then I've been a consultant for them in various ways over the years. I've, just really dialed in and specialized in gut health and become a huge microbiome nerd. And I'm really, really grateful. I tell him this all the time, every time I see him, because the microbiome is key to every aspect of our health. It influences every part of our body. We're more microbes than we are human cells. And the microbes are really running a show. And it allows us so much potential to influence the impacts on our health lifelong. And specifically when we're talking about fertility, it's such a beautiful overlap because the health of our microbiomes throughout our body, impact our ability to get pregnant, to sustain a pregnancy, to have a healthy baby, the health of our baby postpartum, and even the health of our grandchildren. Through the studies of epigenetics, we know that these microbial shifts are impacting, several generations down the line. And so it's really become a huge passion of mine of like, okay, this is my impact, in the world. This is how I'm trying to help families, be healthier and have their kids set up, be healthier, because we have a lot of things up against us that are kind of doing the opposite in modern life. So,
That's beautiful. Thank you for sharing with us. It's really just enlightening to hear your story and kind of the experience that you've had starting out with them so many years ago and just working up to where you are with them now. So let's talk a little bit about the microbiome. So for those that are listening that don't have any idea what the microbiome is, can you explain to them just kind of in simple terms of what the microbiome is and why it's so important to our health?
Yes. So we have many microbiomes. We have microbiomes on our skin, in our guts, in our vaginal canal, in our mouth, et cetera, et cetera. And we are essentially more human or more bacteria than we are human cells, as I said earlier. And so there's, about 10 trillion, I think they say these days, microbes within a human body, and they're really running the show. So it's a mix of bacteria, viruses, sometimes parasites, and other things, but they communicate with our glands. They, are driving hormone production and detoxification. They do a lot of different things. They create a lot of inflammation in the body and direct how many of our organ systems are communicating and or working. And so it gets really nuanced, as you go into the different microbiomes and all the different bacteria and what they do. But, I'm sure most of your audience can, identify with gut issues. I feel like that's one of the most common things I see in my practice. There are so many people who, have really imbalanced gut microbiomes where, they are having constipation or loose stools or acid reflux, heartburn, bloating, excessive belching, very commonly. And they don't really think sometimes twice about it, until maybe infertility comes on board and they're struggling to conceive. And then they're in my office and they're kind of wondering why I'm asking them about their gut health and how that's connected, but it's actually very intricately connected. Or sometimes people just will go, I'm always surprised. Some people in my practice, like I've had chronic GI issues my entire life, and they're coming to me at 30 or 40 years old for the first time seeking help for it. So, our microbiomes are hugely influential to our overall health. And because of modern life and the way that we're moving, there's a lot more toxins in our environment, which really burdens our detox pathways and affects the microbe populations in around our body. There is, a big shift in processed foods and the way we eat, moving much further away from fiber, more heavy, especially now, to very protein, high fat, high protein diets, which actually the gut microbiome really doesn't like. And then also, there's a lot of stress in people's lives, even if not in their family home, there's a lot of stress within the outer world that, people are constantly inundated with technology. We can't really escape it. And, even just simple things like lighting in indoor homes, impacting people's circadian rhythms and their HPA axis function, which regulates our hormones as well. So, and our guts, so there's just so many factors in modern society that are very, very common that negatively impact the gut. And consequently, we see, huge amounts of GI issues in all of our patients. And then we're also seeing a rise in chronic disease, amongst all age groups.
Yeah. And I think noteworthy of repeating just a couple of things that you mentioned, or just, bringing the point together, is like common does not equal normal. That's something that we say a lot as naturopaths, right? But it's just a reminder, if you're listening, that if you've had gut disturbance for the last 20 years, or you've been stressed for 20 years, or you have a hard time falling asleep, these common things, or things that are common in our society even, doesn't make them normal and doesn't mean that they are a symbol of good health. So, it's important to evaluate these things as we move about life and say, like, just because I experience it, does that mean it's normal? And just kind of like have that check with yourself, right? What do you feel, or what would you say is like the biggest disturbances that you see in people's health when their microbiome is out of balance? Or what are red flags that they would know that their microbiome is out of balance?
Yeah. So, Any GI issues, constipation, bloating, excessive gas, excessive belching, loose stools, undigested food in your stool, mucus in your stool, blood in your stool, floating stool. So anything that's not a smooth, formed log is considered abnormal. So really, taking the opportunity to, look at your bowel movements when you have them and assessing and tracking, the health of your stools, I think is a very good daily insight to how our gut is doing. But people can have really great digestive function and still have very disrupted gut microbiomes. And that's just, everybody's unique individual expression of disease is very different. And so sometimes it's going to come out as skin inflammation, eczema, psoriasis, lots of acne, things of that nature can be really associated with gut dysbiosis. Allergies, is a big one. If somebody's like, I want to know if I have leaky gut, I always say, well, you do. Because at this point, I've looked at thousands of stool analysis from patients all over the country. And, I've never seen a stool analysis from someone that doesn't look like they have leaky gut. So most people are dealing with leaky gut. The degree of that can vary. Leaky gut is essentially when the cells that line your intestinal lining are loose and they're broken open and things are getting into your bloodstream that shouldn't be. And then our bodies, being so intelligent, recognize these, food proteins and things as foreign and invasive and start attacking them and creating antibodies and things to them. And so we see multiple food sensitivities as another sign, because people will develop antibodies in their system to foods that they're eating regularly if they have intestinal permeability. So people having to really limit what they can eat, go on very restrictive diets to not be symptomatic. That's a way they can manage symptoms, but that doesn't mean they've fixed or solved their problem necessarily. Any autoimmune disease, any chronic inflammatory disease, if people are dealing with, chronic body pain, or anything related to chronic inflammation. So endometriosis is a really good example of that, where it's really driven by immune dysregulation and inflammation. 70% of our immune system is in our gut. So if we're getting sick a lot, and if our body is just generally showing signs of being really inflamed and uncomfortable, it's always a good idea to deep dive into your gut.
Yeah, absolutely. I'd love to take a little aside of something that you mentioned too, in terms of the food intolerance testing. So that's a lot of IgG, IgE testing. I personally don't love those food intolerance evaluations, because to kind of mimic what you said is they're just proving again that we have leaky gut, right? Because the proteins from the food we're eating are in our bloodstream and they shouldn't be there. And so now your immune system is activated, like you said, almost in every situation. When I've looked at one of those, if a client brings me results that they had from a previous provider, they'll often say something along the lines of, everything I eat came up on this investigation. I'm like, yes, because it's all going through your gut, because again, you have leaky gut, like you said. So I think that's just something for people to be really aware of, because I think a lot of providers and a lot of people put a lot of weight into those food intolerance evaluations when we don't necessarily need to be that restrictive forever. It doesn't mean you're intolerant to those things forever. It's just to work on the microbiome and healing the gut and all of those things. Yeah, absolutely. So talk to us a little bit about the microbiome outside of the gut. So we've got our gut microbiome, we have microbiome on our skin and the vaginal canal, other places in our body. How does that influence what you see?
Yeah. So two big ones that I think about a lot are the oral microbiome. Whether or not we mouth breathe or nose breathe impacts the state of microbes we have in our gut. There's a lot of bacteria that thrive in environments where there's more oxygen. And so if you have your mouth open all the time when it should be shut, when we're breathing, that creates more dysbiosis imbalance in the oral microbes. And then we're swallowing a lot of saliva every day. And so, that gets into our lower GI tract as well and can affect things lower down. If we have, poor oral hygiene in terms of flossing and brushing, types of toothpaste we use, foods that we're eating, things like that can all impact it. So I think about the oral microbiome a lot with overall GI health, and then also the vaginal microbiome in the line of work that I do with fertility is a big one. And it's something that's really emerging, and we're getting so much good research now showing how the vaginal microbiome really impacts infertility, and not just infertility, but actually the health of a pregnancy, the ability to carry to term, things of that nature. And so that's a big emerging pool of research that's very exciting.
Yeah, that's something that we're doing a lot of work with in our program and our clients that we're working with as well. We've started testing most of our clients' vaginal microbiome for the balance of the different bacteria and things that they have. And I will say, I was even surprised when we started doing this, how much dysbiosis that we were finding in the vaginal canal once we started testing that. And I think just to kind of take like a fertility aside, what's so important is, and maybe you can talk a little bit more about this, Elizabeth, but how the vaginal microbiome of the woman influences the genital microbiome of the male, and how we're often like passing these infectious bacteria back and forth to each other, and how it's so incredibly important when we are working on the vaginal microbiome that the husband's also undergoing treatment, or else we're just passing that microbiome back and forth to each other. Is that something that you'd like to add to?
Yeah, it is a really big, important thing. And I talk about this in general because we actually share a microbiome with the people we live with. So there's something that we call the microbiome cloud in our home. A lot of the dust in your home is actually cells, like skin cells. And so, and even though we don't like to think about this when we flush the toilet, like there are microbes that get aerosolized into the air and then travel through our venting and into our home. And, we're in close contact with people we live with, right? We're kissing them, snuggling them, eating, sharing food with them. So there are some studies that show like if an individual takes a round of antibiotics, the people in their home that didn't take the antibiotics themselves will see similar decline in microbial populations, even though they didn't take the antibiotics. So we actually very much know that the people we live with, we share a microbiome with. And of course, if we're engaging in intercourse with people like that, there's even a closer, contact that's coming into part. So for vaginal infections, it is really important, to treat both individuals and, to really encourage both people, especially with fertility involved, to take and, take initiative in addressing their health.
Take it serious, right?
Yeah.
So often the burden of fertility, we know this falls more heavily on female centered, right? But I can't speak for you, but the longer that I work in this, the more that I see there's just so much more male infertility than we give it credit for. And it comes into play in the microbiome as well. And I would say too, STIs or sexually transmitted infections or other sorts of infections seem to be more asymptomatic in men than they are in women. So men can have some of these pathogens and not know it more so than women can. And so, again, it just adds a layer of complexity and importance for them to take it serious and be involved as well.
Yeah. And men, statistically, just don't go to the doctor as much. They're much more apt to ignore symptoms and not seek help. There's very real statistics, and I'm sure in both of our practices, mine's predominantly women, and the women will bring their male counterparts in, often. And that's wonderful. I'm always really encouraging that, but it's very rare. I think I can think of one person in the last 5 years where the male booked the appointment and the male was filling out the intake forms and do it spearheading the fertility appointment for him and his wife. And I actually really acknowledged that to him because I was like, I never see this, So yeah, I
just had one of those a few weeks ago too. And again, commended him very much. This is very impressive that you are here initiating this conversation. I'm impressed right now. It's great. Talk to me a little bit about, you mentioned antibiotics. So let's talk about antibiotics. What impact does one round of antibiotics have on the microbiome?
Yeah, it's pretty detrimental. I mean, antibiotics are not selective in what they're killing off. They're killing off the good and the bad microbes. And sometimes, in life-threatening infections, they are life-saving. And so we are grateful for them, but the reality is that they're vastly overused. And even one dose, so not even one course, but even one dose of antibiotics can significantly increase your risk of depression. Which is wild. People, sometimes don't think about the effect that the gut has on their brain and their mood. But, the studies around that have always really stuck out to me because it's just one dose, and sometimes people are on antibiotics. Usually it's a 5 to 10 day course. But sometimes people are put on antibiotics for 5 to 6 months if they're dealing with chronic sinusitis or diverticulitis or some, bigger issue. And doctors seem to be really callous to the impacts of that on their overall long-term health. I had a patient who was on I think 5 to 6 months of antibiotics before she came to see me. And when we finally did a stool test on her to assess her microbiome, her alpha diversity marker, which is a marker of your overall number of species in your gut. And we want this to be somewhere around 200 different species in a adult gut microbiome. Hers was 16. Like, people at the lab couldn't believe that she was even actually able to live with that low of a microbiome, considering we're more microbes than we are human cells. Like, how is she still alive? And we've been able to really increase that. I think the last time we tested it was 150. So you can bring it back, but the problem is that a lot of times when these populations are going back, these microbes that are considered opportunistic microbes will take over. So these are things like Candida. And so a lot of women experience, yeast infections after a round of antibiotics for that reason, because without the good guys to keep them at bay, then they can flourish post antibiotics. And so it's really important after a round of antibiotics, if you have to take them, to use, probiotics that help restore and reset the microbiome and bring things back in the right proportions.
Yeah. How do you feel about using an antifungal at the same time if you have to take an antibiotic for some reason, using an antifungal with it at the same time?
Yeah. I mean, I think if somebody's very prone, it's something that you can think about doing if they know that they always get a yeast infection. But I find really good benefit with using certain microbes like Saccharomyces boulardii, which is really good at going after fungus and Candida. So we use that at the same time because it is actually a fungus. So it's not going to be killed by the antibiotic. So you can take it at the same time. And then I usually do I have a general rule of thumb where if you're on a 10-day course, you do 3 times the amount of a very intensive probiotic protocol afterwards. So 30 days of, Saccharomyces boulardii. I use Spore-Based probiotics that, can create natural antibiotics to things out selectively that we actually want to keep at bay, and they can upregulate the microbes we want present. So they really help modify in a healthy way how things are growing back. So we can do, lots of stuff around that to rebuild the microbiome in a beneficial way. And that's usually what I do in practice. And I don't see a lot of my patients getting yeast infections, if ever.
That's great. And so I think to add to what you're saying, I think what you are conveying also is that you're using multiple strains of probiotics also, which is so important because, again, to echo what you said, these antibiotics don't discriminate. They don't know the difference between good bacteria and bad bacteria, right? So we're using multiple strains to rebuild. What about herbs? I think that a lot of times people assume they're herbs, they're safe, they're not going to damage my microbiome, but we can use herbs really high dose, similarly to the way that we use antibiotics. Do you see that have the same impact on the microbiome?
It depends on the herb. I think some herbs, are very strong, like oil of oregano, thyme, some herbs, garlic, they have, more affinity for certain things. So I think it's really understanding what type of herb, but like berberine, for example, there's a lot of really good research showing that it really doesn't knock out, any of the good microbes. And so I feel very comfortable using berberine long-term with people at low doses or even at high dose or short-term, but I'm less comfortable using just broad spectrum like herbal antimicrobials. There's certain products that just have a lot of different antimicrobial herbs, and I don't think those are good to use long-term, without really considering that it probably is also impacting your gut microbiome in a negative way just by loss of diversity overall.
Yeah, and they're potent too, right? And a lot of our pharmaceuticals mimic herbs and other things found in nature, right? That's where they come from. So it's important to remember just because it's natural doesn't mean that it doesn't have side effects like some of the other things do. Let's talk a little bit more about the depression piece and help people understand how that plays in and how the neurotransmitters are produced in our gut from our microbes. Would you like to add to that? Can you add to that?
Yeah. So the gut is considered our second brain. There is our vagus nerve is innervated from our gut to our brain. And so there's bidirectional communication between the gut and brain at all times. And if we have, a really imbalanced gut microbiome, which I call, is called dysbiotic, there's likely, more inflammation happening, that these inflammatory cytokines get sent to the brain and also produce what's called leaky brain. And that can drastically impact our mood. We know that, this gut brain connection impacts things like depression, anxiety, worsens the quality of sleep, whether we're dealing with insomnia or how much time we're actually in deep, restful REM sleep. And it also really significantly impacts neurodegenerative conditions like ADHD and autism and, cognitive disorders like Alzheimer's and dementia. And so there's, I think, a huge, potential, again, for especially as we age. I think Alzheimer's and, dementia are one of the scariest things to consider for an aging population. And, they say that it's 100% preventable, even if it's in your family history risk factor, by just impacting your gut microbiome. So a lot of people have studied now, the use of what are called psychobiotics, and they're essentially probiotics that impact the quality of, our brain function and health. And there's some cool studies. There's a study that was done just using yogurt, just 1 cup of yogurt a day for a month, drastically reduced anxiety. There's lots of studies on this one strain, Bifidolongum 1714. Bifidobacterium are very common in probiotics, but the specific strain, Bifidolongum 1714, has the ability to kind of shut down the inflammatory cascade in the brain that impacts depression and anxiety. And those neurodegenerative conditions that I mentioned before. So I love using that strain. And I just want to take a moment to talk about, because it can get, it is so complicated, and, most people aren't studying the microbiome all the time. So people aren't going to know this. And I think a lot of practitioners don't even know this if they're not really niche into this area. But when you take a lot of different types of probiotics, they can compete for binding sites on our immune cells. And so we have to be mindful of the timing of them too. So if we're going to use like a Bifidolongum strain, like that 1714, we want to take it away from spore-based strains so that there's no competition and we can maximize the impact of them. And I say this because it's also important with sometimes, we get these, especially ones that are at the grocery store, they're like 10 billion CFUs of these microbes. And that might look best because it's like, oh, look at all these different strains I'm getting. But those, what are called like kitchen sink probiotics, where they're just throwing everything into one, a lot of them haven't actually been studied on the final product. They're claiming like all the health benefits that they claim are based on the individual strains. And so as microbiome research is starting to really grow, we're realizing that these kitchen sink probiotics like probably aren't doing us good. Like we want to be a little bit more specific with the dosing and timing when we take things, and maybe not, even if we want to have a variety, we don't want to like do it all at once because it can overwhelm the system and our immune cells can only handle so much at once. So I just think that's important to say, that you want to be working with somebody who really understands this and how to dose it, instead of just like buying something with as many strains as possible.
I think that that's such a valid point that you make, really, in supplements overall, right? So specific to probiotics, that's really important, but that's important for all of our kitchen sink supplements. There's so many over-the-counter products available that have a lot of different things in them, or maybe you are making your own kitchen sink protocol, right? And you're just taking handfuls of different things, and our body only has a capacity to absorb so much at one time. So I will kind of use the terminology with my clients sometimes is like, you can take all that, but you're just making really expensive pee, or you're making really expensive stool, right? Because we can't absorb all of these nutrients, whether it's all probiotics or a whole bunch of other nutrients together at one time anyway. So I think that that's just a really valid point overall also to remind people of.
Yeah. And because you asked specifically about depression, I kind of went on a tangent. 90% of our serotonin is made in our gut, which is our happy hormone. And so we have to just remember that if, our gut is really imbalanced, and that's where we make the hormone that makes us feel good, if things are really off, we're probably not making as much serotonin as we could. And that's going to also really impact our mood.
Yeah. And also the communication from our brain to our gut with the vagus nerve, right? Most of that communication is upward from the gut to the brain. So I think that just demonstrates also the importance of our gut health. And you said, I think in the beginning, you said our gut is a second brain, right? And so I think that just demonstrates for us that really our gut has more control than I think that we typically give it credit for. Just to reiterate the importance of that. Today's episode is brought to you by the Fertility Formula Masterclass. My team and I have helped hundreds of married couples conceive naturally without IUI or IVF. If you're struggling to get pregnant or stay pregnant and have been told there are no other options, don't stop searching. There is hope, and finding the root cause is key. If you want to learn more about how we can support you on your journey to motherhood, head over to drnicholemorris.com, and don't forget, Nichole has an H in it. All right, let's get back to the show. What do you say in terms of spore? Well, I guess give us a description or an explanation, if you would, versus like a typical over-the-counter probiotic versus a spore-based probiotic versus probiotics from our foods that we're eating.
Yeah. So spore-based probiotics are my favorite. I mean, I love all microbes, I think. Well, not all of them, but like, I think that all microbes are, fascinating. And there's lots of really good research on really specific strains of lactobacillus and bifido-based strains, which are more common over-the-counter probiotics. So a common over-the-counter probiotic is going to have probably a wide mix of lactobacillus strains and bifidobacterium strains. And those were the ones that, in the beginning of microbiome understanding, there was a lot of research being done, and there's still, very good ways to use those, I think, but very specifically, like not these like big generalized ones that just have a ton in them. Spore-based probiotics are something that they discovered later on, and spores are found in the natural environment. They're not something that we necessarily want to see like on a stool test. Like if we're testing our stool and we get a 20-page report of everything that's going on in our microbiome, we're not looking to see, does our microbiome have spore-based strains, Bacillus subtilis, Bacillus coagulans, but they can go in by taking them orally, they can have this snowball effect on our gut microbiome in a very positive way. So spores are naturally found in nature. They have a spore capsule around them that doesn't it protects them from harsh environments. So our gut, our stomach should be very acidic. If we were to stick our finger in our stomach, it should burn our finger. That's how acidic it should be. A lot of people, if they're stressed or they are drinking tons of water at meal times and things like that, might not make a lot of stomach acid, and it's not as acidic as we want it. But we want to kill things coming in. We want to kill microbes coming in with our food before it gets into our lower GI tract. So that's the point of that high acidity, and it also breaks down our food. So spores, having that natural spore capsule, it survives the acidity, which is one cool benefit. So they get into our lower GI tract alive, and then they can come out of their spores and they can use something called quorum sensing to take inventory of what's in our gut microbiome, and they can create natural antibiotics. A certain strain, Bacillus subtilis, can create natural antibiotics to things that we want to clear. So these pathogens, certain pathogens like E. coli that are very disruptive, and C. difficile and things of that nature. Some of the bacillus spores, increase B vitamin production, K2 production. They increase what are called functional keystone species. And these are the things that we really want to see in our gut. They're like Akkermansia, muciniphila. If people have heard of, Akkermansia supplements, like that's a very important keystone species that we do really want to see in our gut. It can increase bifido strains, which again are the more classic probiotics. It can increase lactobacillus, Fecalium presnitzi, which is really linked to lower, inflammatory bowel disease like colon cancer, colitis, Crohn's. Typically when people have higher Fecalium presnitzi, they have lower rates of that. So the point of using spore-based probiotics is really more to modulate the gut microbiome in a healthy way rather than to put those microbes directly in our gut. So I love using spores because our soil is really poor now. Agricultural practices have really destroyed good quality soil. And so we don't get access to these spores like we used to, like our ancestors did. Food-based probiotics, fermented dairy and kimchi and, kombucha and things like that have different strains. Some of it is lactobacillus based, it's more the classic probiotics that you might see like, from over the counter probiotics at this grocery store. And a lot of people benefit from those. Fermented foods actually have tremendous benefit, but now we're seeing so many people with histamine issues. And fermented foods are very high in histamine. So if people are feeling worse after they eat fermented foods, they might have a histamine thing going on. There are a lot of microbes in the gut that produce histamine. So usually the gut microbiome is again contributing to that problem. So yeah, there's nuance with that, but in an ideal state, fermented foods in moderation is very, very good for your gut microbiome.
What I think that explanation helps people to have a really clear understanding of the value in each of the different types of probiotics and when we use them, right? We're probably not going to use foods to treat somebody that needs to be replenished if they have levels similar to what you were describing earlier, right? Where they don't have the amount of strains that they need. But the daily value in those daily food-based probiotics can be so helpful. Talk to us a little bit about the opposite. So we've been talking a lot about when people don't have enough microbes in their gut. What happens in the situations when people have too many microbes and have more of a SIBO picture? What is your approach then?
Yeah, so after food exits our stomach, it goes into our small intestine. And the small intestine should be less diverse in the microbial population than our colon, which is our large intestine. And when people have SIBO, they have an overgrowth of microbes in the small intestine that are using food, high FODMAP foods, usually as a substrate to create these gases like methane, hydrogen sulfide, and hydrogen gases that cause a lot of bloating, constipation. Methane type SIBOs, typically constipation and bloating are the main symptoms. Hydrogen can be diarrhea or, even nausea or constipation, but people can have combined. And then hydrogen sulfide, bacteria that produce hydrogen sulfide, usually they have sulfur smelling gas like rotten eggs. Anytime somebody eats foods that are high in sulfides and sulfates like red meat and eggs and cruciferous veggies, the bacteria can use that and create this hydrogen sulfide gas, and it creates a lot of usually painful bloating, smelly gas, and other symptoms. And so that is a very common condition, unfortunately. It often develops from use of proton pump inhibitors or acid blockers when people are put on, PPIs and omeprazole, which are really only approved to be used short term. But sometimes, again, like I just had a patient come into my office. She's been on omeprazole for, I think, 4 years because she had one incidence of reflux once in her life, and she got put on omeprazole for 4 years. It's like very terrifying.
It's malpractice, really. It's malpractice. That is malpractice.
It is wild. I was like, oh my goodness. Okay. So, we don't want acid coming up because that does, cause a potential risk for cancer down the line. If you have unregulated acid reflux, it's that acid is going to change the cells in your lower esophageal sphincter, and that can lead to, esophageal cancer later on. So we need to take acid reflux seriously. But again, like Tums and PPIs are not the solution for that, not a long-term solution, because that acid we need to kill the microbes that are coming through our stomach. And so if we're taking acid blockers, it does, block that acid, but it also blocks that antimicrobial, built-in system that we have. So these microbes then get into our lower GI tract that shouldn't. Bile that is produced by our liver and our gallbladder, and bile acid metabolism is really important, and bile is antimicrobial. A lot of people have gallbladder, liver issues, and that can contribute to SIBO. Food poisoning is another one that can be an onset for it, or a lot of antibiotic use. Oral dysbiosis, there's a lot of the same oral microbes in a really dysbiotic mouth. When we swallow, we see the same type of microbes causing more of a SIBO picture. So there's a lot of things to consider with SIBO, and I personally just like to go after root causes, because the classical treatment for that is using rifaximin, and there's like a 90% relapse rate if you do a course of rifaximin. So I sometimes do use rifaximin and find it helpful, but we have to be looking at the root causes and really addressing the whole person and having a more comprehensive protocol with that, because otherwise it's most likely just going to come back.
Yeah. And that's with most things in medicine when we aren't treating the root cause, right? Do you see SIBO rates increase in the elderly because of the way that the stomach acid decreases as we age?
I don't have a lot of elderly patients coming through my practice, so I don't know that I can really speak to that from a clinical experience standpoint, but it makes a lot of sense because
Seems logical. Yeah. Yeah. I
acid
don't see.
production lowers as we age.
Yeah, absolutely. What would be the best advice that you could give for somebody to protect their microbiome or to protect the microbiome of their kiddos?
I think it takes a lot of education, and it's like the foundations are so imperative first. So, we need to be prioritizing good sleep. Poor sleep really disrupts the microbiome. So for sleep of mom and baby, because especially there's something called the first 1,000 days that really sets up the baby's long-term health for the rest of their life. And that is a very critical window of opportunity that is very formative to adult microbiome. I've seen studies that have said, 60 to 70% of our adult microbiome is the same microbiome we had by the age of 3. So the health of mom during pregnancy and dad and their microbiomes, during pregnancy and conception, the route of delivery, so vaginal or C-section impacts antibiotics, either at birth or in those first 1,000 days, essentially first 3 years, massively impact an adult's microbiome. So we have this really critical window of opportunity to try to set up our kids for better health. The chronic health statistics in the US for children are super scary. If you really look at them, they are wild, and it's just getting worse. And so I feel really passionate, like part of a lot of what I do is preconception work, and this idea of just because you can get pregnant doesn't mean that's not the end goal, right? It's like, let's treat preconception care like we would plan for a wedding or plan for a marathon. It's like we have to get our bodies ready and be really educated. We can start wherever we can. So, if this hasn't come through your periphery, don't feel bad. I never want a mom to feel guilt. We have to just accept where we are now and try our best to move forward. Right. Everybody's doing the best. This isn't common knowledge. It's not something that most people are talking about, but I appreciate opportunities like this to get, exposure to more people so that I can educate and be like, this is such a window of opportunity. It's not so much about just, can I get pregnant, but how can I optimize my health, my baby's health, and then that's going to impact the health for them for the rest of their life and their children. So, education, I think is big. And then focusing on those foundations, sleep, stress management, and spending time outside. People over sterilize everything, but all these really toxic cleaners and harsh cleaning products and things that we use in the home, over sterilization. We are meant to be in the natural world. There's a lot of good studies showing that having a dog in a family home is very good for an infant's microbiome because they're bringing in dirt and microbes. So allowing your kids to get dirty, using just simple cleaners. We don't need to have all these harsh antimicrobial everything, especially in our home environments, being outside as much as we can, interacting with the natural world. Diversity within diet is huge. So, I do so much talking to my patients about, I give this list of functional fibers to all of my patients, and it's like a 1-page list that lists all the categories of fibers. So, inulin-rich foods, resistant starch-rich foods, different oligosaccharides, beta glucans, and then there's a paragraph of foods underneath each that feed all the right microbes in the gut. And so I just like having everybody have a very clear list of, these are the foods that feed all the right microbes in my gut. And there's a big list. So try to get variety within each of those categories, as much as you can. I always say the end goal should be 1 from each category every day, and trying to rotate types within each category. And that's pretty far from where most people are eating. Most people are having, a lot of either carbs or protein and very little fiber from plants. So really trying to slowly increase to that. We can't just jump in usually and do like go from 50 grams of fiber a day to 50 because we'll get gassy and bloated and uncomfortable. But with the end goal over time of creating an ecosystem in our body that can handle very high fiber diet and can handle a lot of diversity within foods, that we're not really restricting our diet very much. That is very, very helpful. And one of the biggest impacts of like overall gut health is how diverse your gut microbiome is. So fiber, fermented foods, which we talked about, some people have to be cautionary, but there are really good studies on fermented foods, especially for kiddos. And then avoiding overprocessed things, of course. Things with a lot of emulsifiers are terrible for our gut lining, which impacts leaky gut. Sugar, alcohol, all the major offenders, they're bad for our guts and health.
Yeah. And when it comes to your kids, like ditch the hand sanitizer, let them play outside in the dirt, let them eat their sandwich before they wash their hands after they were playing in the dirt. Like those microbes are so good for us. You mentioned carnivore at the beginning, or just high protein diets. In this conversation, like, what's your opinion as a microbiome expert in carnivore? It's so popular. Everybody's doing it.
Mm-hmm. Yeah. I think that people are just missing. I think that the rhetoric and understanding around high protein diets makes a lot of sense, especially like perimenopause is a big conversation, in at least the communities I'm in right now, and, building muscle and protecting our, metabolism and our bones and our brains, as we age in a healthy way. And that is all very true and valid. And there's a lot of good research around that, and the blood sugar stabilization that comes with higher protein diets, I think is very true and legitimate. The problem, I think, with that messaging is that I don't think people realize how dysbiotic most people's guts are. And so I've been, as a consultant for that microbiome lab company, I've been looking at stool samples for providers that run their tests for 7 years. And so I do about 15 of these consults a week where doctors, MDs, chiropractors, naturopaths will run this test, and then they'll book an appointment with me, and I will help them interpret their patient's results before they see their patient. And so I've seen thousands of stool samples from patients all over the country. And most people, there's in this stool test, that is run, there's a section for how people's guts are fermenting protein. And I would say that 70% of the tests I see, especially in the last couple of years, are over fermentation of protein. And so any protein that individual's eating, their gut bacteria are over fermenting it. And there's these metabolites that are then being produced from that process, like ammonia, which damages our liver and our kidney and our brain. Something called polyamines, which mess with our intestinal lining, create more leaky gut. Phenols, which are damaging to our kidneys and other organ systems. We have also hydrogen sulfide production, which, increases, like a lot of people have sulfur smelling gas. So you might notice, like, I eat red meat and then I have sulfur smelling gas. Like that is a direct correlation of your bacteria over fermenting that. And so I think people just, need to rewind to like, we have to optimize the gut microbiome first. And then when our gut can digest properly and ferment things properly, we can move towards a high protein diet. But I think people are just skipping that middle step and just going to a high protein diet and not really looking at their gut health and thinking they can handle it, but they're becoming more inflamed and toxic from it.
Do you find that the over fermentation of the protein is happening because of the lack of fiber?
So there's a schematic that shows, we can push protein fermentation towards something called short chain fatty acid production, which are things like butyrate, propionate, acetate. These are building blocks to a healthy mucous membrane, a healthy gut lining. But the studies really show we won't push protein fermentation to short chain fatty acids unless there's carbohydrates in place. And so the carbohydrates can come from, healthy carbs, whole grains, starchy vegetables, but we do need, like, carnivore completely, I think is terrible for the gut microbiome. You starve your microbiome. Like carbohydrates, when they ferment, produce all your short chain fatty acids. So if you're not eating any carbs, then you're not going to be able to make butyrate and acetate and propionate, and those are essential to good gut health. And also lactate production comes from that. Lactate keeps the pH of your gut low, which keeps pathogens from overgrowing. So that's also really important to keeping parasites out and not hospitable in your gut and other pathogens. So we need carbohydrates in diet, and I think we mostly need like fiber. And then I think protein, high protein, a lot of people can handle it once they get their gut right.
Let's wrap up by talking a little bit more about the women's health piece. So share with us a little bit more on the direct influence between microbiome in conception and pregnancy.
Yeah. So, I mean, it's such a big topic. To briefly skim over, the gut microbiome impacts our estrogen levels in our body. Estrogen, when it's produced mostly in our ovaries, when we're in our reproductive years, when we get later into life, it's produced more in our fat cells and our adipose tissue. And then sometimes some of the hormones made from our adrenal glands can convert into estrogen. So that's how our body synthesizes estrogen. And when we're trying to clear it, it has to go through phase 1, phase 2 detox in the liver. And then it gets sent to our gut and our kidneys to be excreted in our stool and our urine. A lot of people have an overgrowth of microbes in their gut microbiome called the estrobolome. Well, they produce an enzyme called beta-glucuronidase that will reabsorb estrogen back into the bloodstream instead of pooping it out. And so in order to have healthy, balanced hormones and not deal with some of the biggest offenders of infertility, specifically like endometriosis and PCOS, we really have to optimize our gut microbiome and impact to effectively clear estrogen from the body and other toxins, which also comes from that enzyme. Beta-glucuronidase can also deconjugate toxins that your body's trying to excrete and allow them to be reabsorbed. So that the major causes of infertility, thyroid health, endometriosis, PCOS, there is a abundance of research around how the gut microbiome impacts all of those. So with fertility, we need to be, doing both at the same time for optimal results. And then once you conceive, we used to think that the endometrium was sterile and that the uterus was sterile. We used to think the ovaries were sterile, but now we have all this research showing that even like the fluid inside our ovaries, inside of our uterus is not sterile. And that is the beginning of the translocation of our microbiomes to our babies. And we know that for example, like bacterial vaginosis, which is a common vaginal infection, it can, 1, cause infertility issues, and 2, once you're pregnant, there's a 5 times increase in risk of late gestation miscarriage or preterm birth if you develop BV. And if you develop BV late in pregnancy, like 2nd or 3rd trimester, the risk of preterm birth goes up like 40 to 84%. So that's where the vaginal microbiome is becoming so exciting, because IVF does a lot of research because there's a lot of money in IVF. And so there are a lot of studies that we have on the vaginal microbiome I've done on IVF patients. And they're seeing that, the success rates of IVF go up dramatically when women treat vaginal infections. So we know there's a huge connection there. And then, just the connection with the uterus and how things are impacting implantation. We know that, implantation, once the egg is fertilized by the sperm and then implants in our endometrial lining. We know that if we have higher levels of good bacteria, that rate is higher. And if we have, other dysbiotic bacteria there, we might not have good implantation. So that's really cool. It's just, there's a lot of studies. And then I think specifically for, again, just like the health of the child and the mom postpartum, we even see studies around, the health of mom and postpartum depression drastically reducing with good probiotic supplementation in pregnancy. And then, just having less complications in your child. If your child has eczema, or severe colic and a lot of GI disruption. I mean, a lot of babies are being put on PPIs, which is, another thing. But, that's so stressful, because you're already postpartum as a mom, your hormones are all over the place. You're not sleeping, you have this newborn baby, and then to add complications with baby's health, it creates so much more stress. And this is all stuff that we can really drastically reduce through optimizing gut health, which I find so cool.
And it speaks to the importance for those in that trying to conceive window. or maybe you're just thinking about starting to conceive in the next year, of doing that work now, right? Because how many women do we see that have asymptomatic BV? I see that all the time in the microbiome testing that we're doing of the vaginal canal. And so if we know you have BV and we can take care of that before you conceive, we know that correlates with more positive pregnancy outcomes. So again, it just reiterates the importance of doing this prep work, just like you would plan your wedding or train for a marathon, like you said earlier, is so important. Last question I got to ask. How do you feel about women who have had babies via C-section inoculating their babies with vaginal microbiome or vaginal secretions? A lot of women will put that on their nipples for nursing to kind of get some of that microbiome to the baby if they were born through C-section. About that?
I mean, C-section babies, we know do have a higher risk of like allergies, type 1 diabetes, obesity, some metabolic issues. But there are some really promising studies showing that things can normalize quite quickly, especially with the use of certain probiotics. So Lactobacillus reuteri specifically, a specific strain of that. That's really in breast milk. So if you're nursing, if the mom has this, is making it, then it can come through the breast milk, but you can also supplement in drops. And they've shown that, you can use those drops, and after like 4 months, it can then bring a baby's microbiome to the same place that a vaginal birth's microbiome would be. So, a C-section, I don't think anybody wants that, right? It's, and so it's a tricky thing. Sometimes I feel hesitancy around really talking about, the negative impacts it can have on a baby. So I don't want any mom to freak out or feel guilty, right? That they, just created, they didn't create, but that situation created a hindrance for maybe their child's microbiome. But I think there's a lot we can do to be proactive. I do like the idea of, as much skin to skin contact, as much, of not washing the baby. There's studies around the vernix that is kind of that like white coating, that comes out if a baby's birth vaginally. Like it's good not to give a baby a bath for 5 days, because that can help foster good microbial growth for the baby. But yeah, I mean, if a mom has to have a C-section, I think, there's lots of things that can be done, immediate skin to skin contact, having some of the mom's like vaginal microbiome rubbed on baby. A lot of it comes from the skin. We know that like vaginal delivery, the baby's microbiome looks like, the mom's vaginal microbiome. So even more reason to pay attention to your vaginal microbiome in pregnancy. But then post-delivery for C-section, usually the baby's microbiome resembles the mom's skin microbiome. And then I think we can just do some things like you mentioned, or using some specific, that's why I like using these really specific strains of Lactobacillus reuteri or rhamnosus for babies and infants, because their microbiomes are completely different than adult microbiomes, and they should be mostly, bifidobacterium. There's, not a lot of diversity in babies' microbiomes. And so there's a lot we can do to try to get them back on track.
Yeah. And knowledge is power, right? Sometimes these conversations are difficult to have, like you said, but when we can share that information and educate, this allows us to make not better decisions, but more informed decisions next time if we're posed with an option, right? So I think it's good to share about that.
And it's never too late, I mean, even if you have a 12-year-old, I don't ever feel like you miss the mark or miss the window. There is a greater window of opportunity the earlier you start, but there's always room for changing the microbiome. There are some really good studies showing that the microbiome can change in up to 24 hours. With dietary stuff, it's not going to last if the changes don't last, but, we have to meet ourselves with where we're at. And I think we have to be proactive, in, taking charge of this. I don't see many, if any, conventional doctors doing more than just like, take a probiotic, but usually they're not even telling you which one to take. I think just, there are a lot of free resources with people like yourself or me that post a lot on social media. There's just tons of information online for free. there's practitioners like us that, can more fine tune and individualize plans for people, just trying to work within your means to do what you can. Great books that have been written, to try to just do what you can now to change things. And I promise you, like, the impact that it will have and how you feel, your mood, your inflammation levels, how you age, your hormones, like, if there's anything, that you can do outside of regulating your nervous system and stress, it's like, take care of your gut microbiome, and it will have so much payoff for you all of your life.
Yes. Well, thank you so much for sharing with us, Elizabeth. It's been great chatting with you and catching up. And I just really feel honored that you took time to be here with us. I think we covered a lot of different areas. We kind of did like a brief overview, right, of a lot of different areas, some basic stuff, some more detailed stuff. So I just hope for all of you that are listening, you were able to take something out of our conversation today that you will be able to immediately take to use and put that knowledge in your cap and make decisions that you feel like are better decisions for yourself and your family. So again, thank you for being here and taking the time to chat with me, Elizabeth. If people want to find you, where can they find you?
Yeah. Well, thank you so much for having me, Nichole. It's a pleasure to be here, and I have so much respect for all the work that you're doing. I feel like we're so in line and sync with the way that we practice. So it feels really synergistic and good to be here. I am most active, I would say, on Instagram, Dr. Elizabeth Wade, share things that, I'm learning and, excited about all the time. There are some web blogs on my website, but I don't post there. And then I have a program you can learn more about for preconception on my website as well. I'm in Portland, Oregon. So if you're local, to that area, you can come see me in person. I do virtual consults for people as well.
Wonderful. We'll put, if anybody's interested, we'll put links to find Dr. Elizabeth in the show notes, the description below the video or below the podcast. And again, thank you so much for hanging out with me. I hope that you all enjoyed the show, and we will catch you on the next one. Thanks for hanging out with me on today's episode of Prescribing the Truth. If you loved our chat, you can find me on all the socials. Come say hi on Instagram at dr.Nichole Morris. And don't forget, I drop exclusive content on YouTube every week, so be sure to subscribe so you don't miss out. Also, I've got to tell you, if you are in need of high-quality, research-backed supplements, check out shopdrmorris.com for my full line of third-party tested, USA-made products. My Prenatal Plus is top of the line for fertility support, and if you've got little ones, grab a bottle of Kids Complete too. Lastly, if you and your husband are trying to conceive naturally without IUI or IVF, my team and I would love to support you, pray with you, and walk this journey with you. Just head over to drnicholemorris.com. That's Dr. Nichole Morris, Nichole with an H, to book a preconception consultation with me. Thanks for joining me today. Stay informed, and God bless.